Hi, my name is Cynthia Chavez, and I was diagnosed with breast cancer at the age of 58. So normally I have my appointments, my physicals, my OB-GYN, everything. I have my appointments in October because it's a good month to remember because that's my birthday month. Unfortunately, 2018, I missed my appointment and did not go until February of 2019. On February of 2019, I went for my mammogram and I was told that something small had come up on the test and they wanted me to go ahead and have another evaluation. They wanted me to have a 3D. So I went for a 3D mammogram, and on the 3D mammogram, it showed that, yeah, indeed, there was something there on my left breast, between 11 and 12, by the way. They said, we'd like to have a biopsy of that, just to make sure. It doesn't seem like it may be anything, but let's just double check. So March, I went for my biopsy, and they asked me to go for another test. And I was officially diagnosed with triple negative breast cancer on May 14th. So after I had that last biopsy, the secretary for the Dr. Linan called me the following day. And obviously I'm close to all of them, been there forever. And when I heard her voice, she says, "Hi, Ms. Chavez." And actually I said, "Hi, mija. Why are you calling?" And she goes, "Well," and you could tell she was nervous. And I said, "Nadia, you're calling me because the news are not good. So just tell me what it is and let's go to the next step." And she said, "Yes, it is cancer." And immediately Dr. Linan came up and he told me indeed that it was cancer. And I just asked, "Okay, so what's next?" And he said he's going to send me to a surgeon, Dr. Landeros, and from then on, he would determine what was going to happen. Went to Dr. Landeros, and indeed he said, "Okay, we're going to go ahead and send you to Dr. Herada." And Dr. Herada did his evaluations, and the decision was made that I was going to have chemo after all. We thought it was only going to be the pill, but it turned out that it was a little more advanced than we expected, stage 2, but still a little bit more aggressive. It was an encapsulated type of cancer, so they kept telling me it was the good cancer, if there is such a thing as a good cancer. But everybody kept saying that if we could choose a cancer, this was probably the best cancer we could choose. So I was confident that I had the best team, and they took care of me. Dr. Herada, Dr. Landeros, Dr. Gupta, was my oncology team, with Dr. Herada obviously being my oncologist, Dr. Landeros being my surgeon, and Dr. Gupta being my radiologist, or radiation specialist. And so the process started. Believe it or not, unfortunately, my process did not start until August because insurance. The insurance kept holding back, but we continued with the testing and everything that needed to be done. And then finally, when the insurance finally approved, then I started my chemo, August the 14th. I was to have 16 sessions. And of those 16 sessions, I was able to complete 13. We had to stop the last 3 because unfortunately I developed a very, neuropathy, a very high form of neuropathy where I was starting to lose complete feeling in my hands and in my feet. And so the doctor felt that it was time to stop the chemo. That was probably one of the scariest moments for me, believe it or not, even scarier than the actual cancer diagnosis, because I was afraid that if I didn't finish the treatment, that it would come back. That was probably my biggest fear. It's like, no, that's okay. If I have 2-3 more treatments to go, I can finish this. But they said no, that it could permanently cause damage. And that's probably one of the things that I wish I had known more about, some of the side effects. Neuropathy was one that I wasn't really considering. I could consider everything else. I consider hair loss. I consider, fatigue. I consider becoming chemo skinny, which, by the way, I was never chemo skinny. I became chemo fat. And so got a lot of weight to lose, but we're getting there. We're healthy now, so we'll work on that now. But after that, I went ahead and had my surgery on January 4th. It was a lumpectomy. My tumor had, shrunk so much that they felt the lumpectomy was, going to be enough. I didn't have to have a mastectomy or much less a double mastectomy, although I was actually prepared for that if that were to be the case. Then after that, a month later, I started my radiation treatments. If you want to know the truth, chemo was hard. Not gonna lie to you. Infusion days were hard because I was fatigued. I was very tired. So after infusion days, I would come and sleep. And then Saturdays, and those were Fridays. On Saturdays, I had a good day, and Sundays was my bad day. So my infusion days was on Friday, my bad days was on Sunday. And when I say it was a bad day, those were the days where I just slept the whole day. I did nothing but sleep the whole day. The radiation was probably more, it wasn't painful by any means at all, but it took a lot more time. I was back at work. I worked through the whole chemo sessions, but taking the infusion day off and then going back to work Monday through Thursday. But chemo was every day for 32 sessions. And at lunchtime, I make sure that I had them at lunchtime so that I wouldn't interrupt my work because I was already back on the field. And those were hard because it interrupted my life, actually, believe it or not, more than the chemo itself. The hard part about this whole process is that I went through it in, COVID. COVID made it more difficult. Sorry, I'm gonna get emotional. COVID made it more difficult because I couldn't see my family. My family was behind me all the way. My family took care of me. My family provided, and my family, my husband and my daughter, my 25-year-old daughter, were the ones that were with me through it all. So they had it the hardest. They probably were the ones that I felt the most helpless with because I could see they were hurting and I was trying to be strong for them. But we all hurt. We all hurt. But not being able to see my dad, not being able to see my sisters, not being able to see my grandbabies, that was probably one of the most difficult times. And COVID made it harder. Cancer is hard. Don't get me wrong. Cancer is definitely hard, but we can fight it. If we find it with enough time, we can fight it, and I knew that. And for that, I was grateful. God was very gracious with me. I really didn't have, if I want to say, I didn't have the side effects that other people do. I was able to work through pretty much all of it. I took 8 days off for my surgery. God was good. God was very, very good to me. And I had wonderful family, my husband, my daughter. So that was good. I think the one thing that was, my family has always known that I'm the one that tries to keep everyone in check when there's a trauma, when there's an emergency or everything. I'm the person that makes everything go smooth. Okay, don't panic, don't this, don't that. That's me. I'm the one that takes care of all this craziness. When it happened to me, it was the same thing. I still reacted the same way. The first news, the hardest part was telling my daughters, obviously, and we broke down and we cried. And then I said, okay, we got that out of our systems, and now it's time to plan. What is the plan? And then we talked about the plan, and we stuck with the plan. So I was good at that. I knew that I could do that. I knew that I was able to do that. So that was, I never realized that I could still be in control, or appear to be in control, because trust me, there were times when I wasn't. I appeared to be in control through it all, and it was just make a plan, let's go with it. And that was important for me and for my family. The most difficult part was seeing my husband and my daughter. They're the ones that took care of me through it all. David's very sensitive. To be honest, my husband is probably more sensitive than I am. He won't show it, but I could tell how much he was hurting. My daughter, she quit her job to be with me because she did not want to bring any infection, because obviously my system will be suppressed. And so she was with me, and that was hard. You know, being 3 months literally at home, locked up pretty much, was hard. Hard on her, hard on David, hard on me, hard on all of us. So I wish that that I had been able to protect them. We had off days. There were days when we cried. And I think that's probably the hardest part about cancer, is that it doesn't just affect the patient, it affects everyone around you. And seeing them hurt was probably one of the hardest things I had to do, and they were doing it for me. Another thing that I did mention earlier, some patients, and I happen to be one of them, will have like a syncope episode. And so I had 3 of those. I call it, say, 3.5, where you literally get so weak and you pass out. Your blood pressure goes very low. And obviously because of COVID, I did not want to go to the hospital. The last place I wanted to be was at the hospital. And so I had to, through the process, I had to teach my daughter and my husband to, you know, okay, don't take me to the hospital. You need to get me up, get me a cold cloth, put it in the back of my head, just keep me talking. And I had to walk them through that. And I know it was very hard on them. And when I was completely out, I told them if I was out for longer than a minute, then they needed to call EMS. They never had to call EMS, thank God. And we did good. We overcame those syncope episodes as well, but they were very scary. They definitely were probably one of the scariest things that we had to go through. Oh my goodness, I'm not gonna lie to you. I was prepared to lose my hair from the get-go. As soon as they told me I was gonna lose my hair, I was ready. We had gone through, unfortunately, my little sister was diagnosed of breast cancer at the age of 34. So we already knew what was coming. So we were prepared for that. I was prepared for that. It wasn't an issue for me to cut my hair. Actually, losing my hair, I initiated it. I went to my niece, who was my hairdresser at the time, and I said, okay, I need you to cut my hair as short as you can before I start losing it. And she was hesitant. And then I said, no, cut it shorter until it was pretty short. Now, I'm not gonna lie, when it was time to shave it, my daughter shaved it for me. She wanted to shave her hair, and I told her, no, you don't have to do that. Nobody has to shave their head to show me their support. I already knew I had my family's support for that. And hair, well, to be honest, to me, it's never been an issue. It will grow as everything else does. This might be a little too much information, but I think people don't talk about this. My biggest fear was losing my eyelashes because I was afraid of getting, you know, what are they called? Eye boogers, lagañas, whatever you call them. I was so afraid of that. But one thing that nobody warned me about, and again, this might be too much information for you to post, but people need to know this, losing my nostril hair, because it made my nose run. I mean, my nose was constantly running, and that to me was not something that I was prepared for. So yes, you lose all of your hair, and you will get all of your hair back. So hair was, for me, the least of my worries, but I know is for some other people very important. I had the most amazing caps. I had the most amazing turbans. Hey, I actually look good with the turban. Maybe I should have worn one for this. My hair, as you can see, is finally growing. It has been growing now since, I'm gonna say, this is my 7th month that my hair finally has started growing. And I'm having a hard time with it because I think actually you're gonna have a more difficult time when your hair comes back, because It's curly in the back, it's wavy on the sides, and it's straight on the top. So you're gonna have to learn to comb your hair, but don't worry about your hair, to be honest. It's gonna come back. In the meantime, focus on wearing the most amazing hats and turbans. I did not want to wear a wig. It made me hot, so I never opted for the wig. Not gonna lie. But if you find something, a wig that you like and makes you look good and sexy, girl, go for it. This is the time to do it. The weight gain. Everybody's used to losing weight. I think the weight gain for me was a bit of a shock. Actually, I was more uncomfortable with that than my actual hair loss, because I couldn't fit into anything. I went from a size 8, 10 to a size 14, 16, and they kept telling me it was the steroids, and I did not feel good. And not only was I gaining weight, I was not eating. Okay, so be prepared to the not being able to eat part. A lot of people say that you get metal mouth, so you use plastic forks and everything that can be plastic because you don't want to have that metal taste in your mouth. I never got the metal taste. I got more of a sand, and when I mean sand, it was the texture and the taste of sand. Everything tasted like sand. So I was not eating, but I was gaining weight. The best thing that I can tell you, however, is don't stop eating. You need to eat, because if you really, really lose weight, you will end up in the hospital. That's what they kept telling me all the time. People that lose a lot of weight tend to end up in the hospital. So after I learned that and I was gaining weight, I didn't feel as bad. I guess my clothes didn't look good, but whatever. But food-wise, eat whatever you can. It got to the point that it said that if all I can eat was Cheetos and sodas, that's fine. Just eat. Don't stop eating, because then you really will get sick. Again, I think God was very gracious to me. I didn't have to end up in the hospital at all through all my treatment. And I kept eating. Pretty much, if you want to know what I ate rice, whether it was white or Spanish rice. I ate shrimp and ham. That is all I could tolerate. I could not tolerate anything else. As soon as my husband found out that I was able to have a hash brown, he would go crazy buying me hash browns, and then I couldn't eat them again. So anytime you find something that you can eat, just eat it, whatever it is, because you don't want to lose weight and you don't want to end up in the hospital. Who the hell with eating healthy? You just want to eat. Okay, you want to go ahead and continue to stay healthy, as healthy as you can, because things can get a little rough. The one thing that I can tell you about radiation, before you start your radiation, they're going to tell you to moisturize the area where you're going to have your radiation, and I encourage you to do that a lot prior to actually starting your radiation. You will get like burnt, literally burnt. Your skin will get a very dark shade, if not actually black. So your skin does get burned, especially on the last treatments, when there's really focus on the area of the cancer. And you will blister if you do not lubricate enough. And that was painful. That was very painful. The blistering and the dryness was extremely painful. So if you can definitely lubricate prior to starting. Lubricate when you can. Obviously follow your doctor's advice. And that's probably some of the best advice I can give you. Eat and lubricate. This is a tough one because everybody's very different. So my husband and my daughter were extremely supportive. They took care of me, whatever need I had. But when it came from friends and family and family outside of the house, well-wishers, provide them with meals. The meals are not necessarily for the patient, believe it or not, but it's for the caregivers. They need to eat too, and they're spending all the time trying to take care of their loved one. So they need to be taken care of. For the longest time, everybody kept bringing all kinds of food, and they kept asking me, what can I eat? What can I eat? And I just kept telling anything and everything. But I mostly had my husband and my daughter in mind. because I needed them to be healthy too. They couldn't get sick, or else who's going to take care of me, right? So provide assistance, I'm going to say, for the caretakers. Yes, definitely for the patient, but more for the caretaker, is where they need the more help. At least that's what in my case. I want to say don't panic, but you're going to panic. So get the panic out of your system and make a plan. That's really what really worked for me, is like, okay, this is what I have. We cried, and I said, this is enough. This is the crying that we were going to do, and now it's time to plan. And so we planned, and how is everything going to happen? Who's going to take me to the infusions? Who's going to pick me up from the infusions? Who's going to take me to the radiation? Who's going to take me to the doctor's appointments? Because yes, you cannot drive. Okay, you cannot drive, so you'll need someone to take you to those appointments. So make a plan. Who's gonna prepare the meals? Who's gonna clean the house? Fortunately, some of us do get sick and we will throw up. Buy a lot of little trash cans. Have them everywhere around the house, everywhere you're gonna sit, just in case. And be prepared. And who's gonna be in charge of that? You really seriously have to have a plan on what's going to happen. If you don't have a loved one that is actually going to be able to take care of you, reach out. There's a lot of agencies. The oncology team can help you, and you can reach out to people. I was blessed. I had family. We have gone through this before, and so we were more prepared than many others. But definitely, get over the panic, make a plan, and just go at it. Just fight like there's no tomorrow. Do not give up. Don't let it consume you. It's gonna be over. It seems like it's not, but those 16 sessions of chemo were over. Well, 13 were over before I knew it. The 32 sessions of radiation were finally over, and it does end. It does end, and you will be the stronger at the end. I am still fat, still trying to lose weight, but I am healthy. I actually am gonna have an appointment. My appointment's coming up October 28th, where hopefully I will have the port removed. That's my goal. My goal is to have the port removed. The port apparently is left there in the event that the cancer comes back. So far, all of my appointments have been good. Nothing is showing that my cancer is back. So my goal is that in this next appointment, I'm going to be told that the port is coming up. If for whatever reason the port has to stay, it's supposed to stay there for a year. My year will be in January 4th. So my goal is to have that port removed, and for them to say, yay, we are 100% over. It's never going to be over. I can assure you of that. Every appointment is nerve-wracking now. Every appointment I go to is scary. But we did it once. I can do it again with the help of my family. And thanks to God too, of course. The port actually, it's where they infuse the chemo on you. I don't know if it's acceptable. It's this little thing right here that you see here. It's a big little round thing here that's put in there. And what that is so that when they actually do the chemo infusion, they don't have to be poking you constantly. It automatically, the nurses just come and they put the infusion and then they put it in here. It hurts a little bit when they prick you on there, but it's fast. And then that's where the infusion is put in through. So you don't get to have any IVs or anything like that. That's your IV. That's where it goes in. So they told me that the first 4 were supposed to be the hardest ones. They weren't in my case. Yay. Then as time progresses, they do get harder. And the reason why they get harder is because your immune system is weakened. It gets weaker. And your system is taking way too much. What did the doctor say? One of the doctors said, we're killing you from the inside out. And it's true. So you get weaker and weaker and weaker. And so that is why you have the syncope episodes where you feel like you're passing out. And sometimes you do pass out. So yes, they get harder. They don't get easier. But again, you overcome them. You really overcome them. Advice is to pay attention to your body. Gosh, definitely pay attention to your body. You get a list of all the different side effects, and yes, neuropathy was there, and you know that this is going to happen to you, and you go, okay, well, this is a side effect. Let your medical team know about your side effects. I was trying to be extra strong that I didn't tell them about the neuropathy, about the missing feeling on my fingertips, because it was expected, but I didn't know that it can be permanent. And so when I finally told my nurse, my complaint was actually my fatigue. I was getting extremely fatigued. I was needing to nap a little bit more than normal as the treatments progressed. And I let my nurse, my infusion nurse, know. And she said, you know what, let me let the doctor know that you're getting more and weaker. And the doctor immediately came up. He happened to be there. He came up to the infusion center and he saw me. And then, believe it or not, the fatigue was not his concern, because that's normal. But it was the neuropathy. And that's when, on that day, that he decided, yeah, no, it's affecting me a little too much. And I needed to stop the last 3 treatments. So pay attention to your body. Let them know everything that's happening to your body. I tried to be stronger than I should have been, and I could have done permanent damage. Thank God the team was wonderful, and they saw that, and they stopped it. And I'm good. I have a little bit right here on the tips that sometimes I cannot feel, and the same thing with my toes, but it's pretty much gone. I'm back to, I'm gonna say 100% normal. Yeah. You know, going for the infusions was actually hard. Number one, I never saw myself there. I saw my sister there. I went with her there, and I knew what to expect. But I think what was really, for me, what was really telling, I was working even during my infusions. I would take my laptop and I would try to do work there. Some work, not a lot, don't get me wrong. But then I would see some of the other patients, and some of them were very, very ill, very, very sick. So I always felt very blessed that I wasn't where they were. I don't know the type of cancers they had, but I was very grateful that I wasn't where they were. And I think twice was very scary, where they had to call the ambulance and take 2 of the patients that were receiving infusions there. And I freaked out. Those were the times when I would freak out, because I always worried that, what if that's me next time? So that was nerve-wracking. That was scary. But I just kept praying. And I had a very, very strong team. And I had God on my side, definitely. My sister was diagnosed at 34, twice, at 34 and at 39. So the first time was right after she had had her baby. Her baby was 6 months old. And they just thought it was a milk duct, actually, because she was breastfeeding, and they thought it was that. And then she felt a lot of pain, and then finally they decided to do a test on her, and now her cancer was extremely advanced. I don't know why, but her cancer was extremely advanced, and on her they had to literally immediately, on the following day, they didn't even wait for insurance. That's how bad it was, that they took her in and they put the port on her. She started chemo. She had a mastectomy. I mean, hers was so fast. And then she had continued with the chemo and the radiation. So yes, it can be extremely aggressive, and she had one of the most aggressive cancers. And then they say that after the 5th year that you should be cleared. And unfortunately, at 5 years and 7 months, she developed the cancer on her other breast and went through the same thing. And she's fine though. She's been cancer-free for 15 years. So, but she went through it twice. And I think she was probably one of the reasons why I felt that that I was okay, because my daughters were already adults. I didn't have a 6-month-old or a 2-year-old, and I was going to be okay because my kids were grown up. And if my sister could go through it twice, yeah, I could do this. So actually, because my sister had it, we were all afraid that it was hereditary. It's not. It's not in our, anyway, I had the test. No, it's not hereditary. It's not hereditary for her as either. It really, breast cancer has never been in our family, but there has been a lot of other cancer in my mom's side, but not breast cancer. We were actually the first two that have, well, my sister first and then me, that have had breast cancer. So it's not hereditary. So we were really, you know, taken aback by it. And triple negative, it is my understanding, is like, yeah, I never should have had cancer. There's really no reason for me to have had this cancer. But I did. And a lot of young women are getting it. It's my understanding from my work. In my work alone, the year that I was diagnosed with cancer, I had 3 other colleagues that were diagnosed with cancer. And one was 47, one was 36, and one was 51. And then myself at 58. And we were all going through it pretty much at the same time. Only one of them, I believe, was possibly considered hereditary. The other 3 of us were not. So yes, it's very eye-opening when you just assume that it is hereditary. So no, get yourself checked. Check yourself. Check yourself. Check yourself. When you're in the shower, when you're laying down with your doctors. Again, my appointments are always in October. I happen to wait till February. We tend to take care of others and we don't take care of ourselves, and we get busy with life. And unfortunately, I let myself get busy with life. And I have to think about it, to be honest. One of the thoughts was like, if I had gone in October, would we have caught it then? Or if I had gone in October and nothing would have come out. So it's that hindsight 2020, maybe because I waited till February we found it. I don't know. I always have that question in my mind, to be perfectly honest. Was I too late or was I just right? But nonetheless, don't ever let it go past 6 months. Go to your appointments. Get yourself checked. Please check yourself. Thank you, El Paso Spine Center, for hearing my story, but more importantly, for spreading the message. So all of you women out there, young and old, make sure you get yourself checked.